that I have less of these as a brewer.
All right, let's get started. We're gonna have people joining us. Thank you for joining us today for our November, actually it's November 3rd. It says first on the PowerPoint, but it is the 3rd, I believe. For our November 3rd update, it is a special one. This one's designed to give a brief update, but then we're gonna talk a little bit about the verified vaccination program, specifically designed for restaurants, for our breweries, for our entertainment facilities, and how you can design that program, especially with the news that they have approved a lower dose for our 5 to 11-year-old kiddos. So that's exciting news coming out, and that will make it easier for some of our facilities that bring in our youth to be able to apply for this program going forward. So we will get started. We do not have Lane on the call today with us today. It is actually Tessa. We have Tessa, who is leading the vaccine program for Boulder County Public Health. She's going to give a brief update. I know we have a couple people on that are not one of those key into those industries, those restaurants, and so you're on probably to hear some of the updates on the numbers. So once she gets done with that, if you would like to stay on, you can. If you would like to leave, no offense taken, you can leave, and then you can send me questions throughout the week if you would like. So let's start with Tessa. I did just mute you, so you'll need to unmute yourself. If you hear dogs in the background, all of us have dogs in the background, so we apologize. I have a barking dog. Tessa has a barking dog. It's the life we live working from home at times. Well, Tessa, take it away.
All right, thanks, Corinne, and thanks to everyone for taking some time this afternoon to participate in this session. This does say November 1st because that is the date that this data was pulled by our epidemiology team. Oh, I'm having that. It's not advancing. I'm going to stop sharing for a minute and try again.
For those of you wondering, we do have a special guest on today, Brandon. He's a local brewery owner who's going to share his experience. So we did have some people who say hi to him. So that is who is joining us as well. So hi, Brandon. Tessa will be sharing.
My apologies for this technical problem. I don't know why it's just these chamber calls. It likes to get a little wonky. I think this is it, the magic time, 3 times the charm. Okay, so you all are aware that there is an advisory that went out on Friday, and that is because of the rising cases happening in Boulder County and statewide. You're probably also aware that Governor Polis put a halt to cosmetic procedures and some other elective surgeries because our hospitals are in a surge mode. So what you'll see here is that we are up to 238 cases, which is an increase from where we were last year at this time and last week at this time. So we're continuing to see a rise. We see some challenges. The surrounding counties have continued to increase, and you'll see this play out specifically. Most of the cases in Boulder County are happening in Longmont, and adjacent to us in Wells County, you can see that those cases are high too. So basically across the state, except for Grand County, we're in a higher transmission rate than we've seen in some time. The greatest increase in numbers is between the 23 to 34-year-olds, and then next to that, they're 35 to 44-year-olds. The cases by race and ethnicity are staying mostly the same demographically. And that the majority of cases are happening in Longmont, as I mentioned. And what we're seeing is just this trend really of the surrounding counties that don't have a mask mandate in place, where there are people coming across county lines, is having an impact on our overall caseload numbers. And looking at the hospitalizations for this week, we've gone down 1% in terms of our ICU bed availability. We're the same at our surgical bed availability. Staffing is still short. There are 3 more people hospitalized this week than last week, and there are 21 pediatric confirmed cases, and I think that there are 17 presumed COVID positive cases of youth as well. So we are in surge conditions, and our epidemiology team, both here in Boulder County and statewide, is not able to handle this surge in terms of contact tracing, being in touch with people. So we are above where we're able to manage that caseload and support the community and letting them know what's happening with COVID cases. There have been 30 deaths since May of 2021. So again, we're seeing a big increase compared to where we have been starting from last spring. And many of the deaths are elderly individuals. There was a 40-year-old who died last week. Testing is happening, testing is up. The positivity rate is at 6.2%, which is higher than last week's positivity rate of 4.6%. So again, it's all these numbers are just aligning with an upward trend. And with vaccination rates, as Corinne shared, amazing news that the Pfizer is approved for younger kids, which we're really excited about. We think that, that's going to help us get our numbers down as kids get immunized, and for businesses who want to participate in the vaccine verification program, that just opens the doors for that participation. And we're continuing to do outreach around immunization. Please reach out to Corinne or to me if you want more information on that, and providing materials on the safety and efficacy of those vaccinations. And then here are all the data resources that are available. So with that,
I actually want to bring up our next program is actually going to be, we're going to do one on November 17th. We're going to give the data update. We're going to talk about, what's going on in Boulder County, but we're going to bring in a guest speaker to talk about immunization hesitancy and really how to overcome immunization hesitancy in our community and in your business. So if that is something that is an issue, or something you'd like to talk or hear about, it will be the 17th at 2 o'clock, and we are bringing in a guest speaker. So it'll be Lane Drager as well as another guest speaker from Boulder County Public Health to talk about that hesitancy piece, both in youth as well as within your workforce. If you're facing this within your workforce, there's some tips and tricks, some resources, some of the messaging, and that's our next program. So November 17th at 2 o'clock, I'll be pushing out information about that along with some other resources in my next email, which will go out with the recording of this video.
Thanks, Corinne. So I'll just briefly cover the vaccine verification program. I imagine most people on this call are somewhat familiar with it to be participating, but essentially when we passed the masking order on September 3rd, we in that had a program available for people who wanted to require that people in their indoor facility have provided proof of vaccination, so that 95% of people in an indoor space are fully vaccinated, and with that you can remove masks. So this is unique because restaurants are already able to have patrons remove their masks while eating and drinking, but we do think at the same time, servers and kitchen staff and hostesses and hosts still need to be masked up. So this program would allow all people within a restaurant or brewery to be unmasked is one piece of this. And the other piece is that what we've seen nationally and in Denver, where there are restaurants that have, and locally, places that have implemented vaccine policies, Some restaurants are seeing their busiest days. There are a few places that have said Wednesdays only, and Corinne can share the articles about this. Wednesday night is our vaccination night, and they've been busier than ever before. A few local restaurants who are trying this out are also having great success. And again, as we've tried to stress with this program, it's really flexible to meet your needs. So if you decided to try this out, you could just say 1 day a week, we want to be a vaccine verified facility, and just test the waters, see how it goes. It's not a requirement that at all times that this would need to be how you're approaching this policy or this program. And to apply for the program, you can go online to our vaccine verification facility page. It has all of the details of the program. It has a checklist of what specifically you would need to include in your policy. And we have a team who is available to answer questions and walk you through anything that's not clear. We really want to work in partnership and are really hoping to get some more of our restaurants and breweries on board with this program. And I guess, Corinne, I don't know if you want to turn it over to Brandon.
Sure. Brandon, who is actually one of the approved facilities. So why don't, Brandon, introduce yourself, talk a little bit about, will you talk a little about who you are, what your business is, and why you chose to apply for this program, and kind of the steps you went through and what results you've seen.
Yeah, sounds good. Can you hear me okay? Perfect. Hi, I'm Brandon. My wife and I are the owners and all the employees over at Primitive Beer in Longmont, Colorado. We are a kind of super niche brewery that focuses on a single style of beer that is produced spontaneously with microbes in the air based off of a tradition called lambic out of Belgium. Without going too far into the geeky side of the beers we produce and that kind of thing, I will say that by and large, the program has been really successful for us, and I'm more than happy to go into areas of turbulence versus less turbulence. But it was at first something that really stood out to us when it was offered. One, I am immunocompromised myself, and two, we have a 4.5-month-old daughter. So as a function of wanting to present an environment that was, potentially as safe as possible for our family, as well as the patrons to our business, this was a program that stood out. We actually closed the brewery's tap room in March 2020 and had not been open for on-site consumption of any sort until this program opened up in September. That made implementation of this quite easy for us relatively. So I understand our business and the implementation isn't going to have perfect analogs to restaurants that are starting it, et cetera, or larger breweries that house more people at any given time. But in August, we actually took a trip to New York, where I'm from originally, and saw this type of program utilized all over the city. And the fact that vaccine requirement and the checking and approval was just required anywhere you went in the city, whether restaurants or bars or kind of other public spaces. And given that the My Colorado app and I think it's the Empire State app or equivalent were so similar, it already off the bat made sense, seeing that it could be utilized in a way that was relatively efficient and convenient in that form. So when we got back from our trip, showing the granddaughter to the parents and all of that, and then coincidentally this program was opened up in early September, we knew that made sense for us to try and open our brewery for on-site consumption again, as opposed to just to-go sales that we were doing once weekly. And really from there, we've aimed for the 100% as opposed to the 95% of people allowed inside having that vaccine requirement, knowing that every once in a while, if someone came in with a party and everyone else vouched for that person and said, no, this person is totally vaccinated, they just can't find any proof. If that one person in every 20 was allowed in, that kind of worked with the metrics of actually still fitting into that 95%, but trying as best as we could to make sure that any group does have that proof of vaccination, and still allowing some degree of flexibility in that way. Let's see what else. Or what other topics do you want me to kind of cover? What haven't I hit?
So talk a little bit about the policy procedure. So a lot of the questions we get and Tessa gets are about the generation of the policies, the internal and external policy, that you created. How did you develop the policies that you then submitted? Who did you consult?
Yeah,
What did you do to generate those
actually,
policies?
sure. A lot of those policies were actually built around some of the writing that was provided by, Boulder County, or examples of kind of sufficient policies. So taking those and looking at what made sense for our business. So I mentioned before, the business is my wife and myself. It's definitely a small family-run business. So from that instance of making sure that all of the employees were fully vaccinated, that was fairly simple. Our vendor list was relatively small, since we only source Colorado ingredients for all of our beer, and we were able to very quickly verify that any of our vendors were also kind of fully vaccinated and compliant in that way, or not able to enter the facility for that as well. In terms of some of the signage, basically looked at what made sense. That was something that we had to kind of, one point that we realized we could improve upon, especially with early implementation, was just larger, more prevalent signage. Instead of, I think people would look at that sign early and think that just assume it said mask required as opposed to vaccination required. So having it basically like 2 foot by 3 foot A-frame signs by every entrance made people a lot more aware of it, as well as putting a lot of that information on social media and making a point of, almost to the point of controversy, of saying this is a program that we've put into place, and that it's required. I think the signage also took a lot of the pressure off of me, especially in the beginning, when people didn't see the sign as well that said vaccination required, and would come right to the door where we had a little bit of a barricade and another sign. I would go to check their vaccination requirement, and that was, even by fully vaccinated people, sometimes met with a little bit of antipathy, just based off of surprise and not knowing that they had to have it with them. Whereas when all of a sudden much larger signage was put in place, it was like, oh, it's not me who's asking for the vaccination requirement. It's the sign over there, and they're knowing to expect it, et cetera. So, it's actually no different, but for whatever reason, that seemed to, it could be a function of that, as well as just more people getting used to and understanding that, that vaccine was required.
Did you put any
But yeah,
Did you put any notices out on your social media, email blasts, through media, or anything that to alert your regular customers or others that you were moving in this direction?
totally. And as I said, again, because it's not a perfect analog, because we were reopening for the first time for on-site consumption in over 18 months, making it was even more prevalent. So basically, we put out a blast on, Instagram and Facebook, or Meta, whatever you want to call it at this point, and any other kind of form of communication with our potential patrons and customers. Basically, let them know, okay, we are reopening. Here are the times of the days of the week that we've now expanded our hours. We have now expanded outdoor seating as well as socially distanced seating inside. But even more importantly, here is this program that is being put on by Boulder County Health, and we are a part of it. Here's what that requires. Here's what it means, and probably put something out on social media 3 times in the first week. And then even when we were making other social media posts, that kind of emboldened vaccination requirement in effect has been on most any social media blast that has had to do with basically our opening hours and come visit the tap room. So that was a big part of it, was being able to reopen with that as a very obvious component, or as obvious as possible that we could from social media.
So this brings me to a question for you, Tessa. He mentions outdoors. You talk about a lot about flexibility. This program is designed really for indoors. One of those flexible components could be that the vaccination requirement is for the indoor component of the building, and that the outdoor seating could still be open to all patrons. Correct?
That's exactly right. And with the participating restaurants, that's what we've seen, especially, you know, in this transition time to younger kids being able to be vaccinated. Families can absolutely still come and they can sit outside, and then vaccinated patrons can come inside.
Well, and then another business, so Cafe Aeon was one of the very first ones to promote that they were doing this in the area. They sent me the information on what they've done, and that they did that all guests that dine indoors need to be vaccinated and show proof of vaccines. The proof could be the actual vaccine card, a photocopy, a picture. That this means that kids, you know, under 12 can't dine indoors, but they do have the outdoor space, and that there is the extension, the outdoor. That the feedback they've gotten, and Brandon, I'm going to ask you this question too, but the feedback they've gotten is that guests have expressed appreciation. And I've seen this also in some of the gym facilities, that people that have implemented this policy, some of those classes are some of the largest attended that they've seen. They have expressed appreciation that they feel safe dining indoors, because you do have to remove your mask to eat, and that you are close and you are talking. Folks have come to support specifically because of the policy, and they've gotten very little negative feedback via email, metaverse or whatever you call it now, or Yelp and Google reviews. People haven't shown up in person and had anything negative to say, and that that they've just had an uptick in business because they've announced their vaccinating policies. So they made this decision because they wanted to keep people safe, and that they moved forward with this. And this was they wanted to do this as opposed to the reduction in capacity, and they preferred this over reduced capacities. That came from Cafe Aeon. They sent me this information beforehand. Brandon, what's the reaction you've gotten?
Yeah, the reaction that we've gotten has been by and large positive. Kind of back of envelope, from a response, maybe a response bias standpoint. 10 groups have come in that have said, we are here specifically because of the vaccine policy. We're not sure what kind of beer you produce, and we've never been in before, but we found out that you were doing this. And it's always ironic when then they come in and are like, oh, sour beer, I'm not really sure about this. But the vaccine policy has certainly brought people in that otherwise would not have been, which is interesting. I would say we've had 3 in-person critical conversations, we'll call them, with people who were outwardly offended by the fact that we were instigating this policy. And the conversations all pretty much went the exact same way. And it's also ironically, I think 1 out of the 3 groups were fully vaccinated and still had a problem with it. But basically said, started to go through, the vaccine doesn't, prevent you from getting sick. And then we have to go into the whole idea of, well, it's actually not about necessarily the individual, but really the collective whole and reducing vectors of transmission, et cetera. And then after a little bit of science, it basically turns into, well, I think that's bullshit. And then we have to say, if this is going to be a problem, we don't have to do this. We can, politely go our separate ways. And in each one of those instances, the people just left and wrote negative reviews. And then we've had some instances of just random, but the internet is easy to just not look at. It's probably about 3 to 1 super positive to, kind of negative. And then anywhere in between, people are happy and comfortable. And so I would have to say then for the rest of the people who don't want to even talk about it, they are clearly there. And there is a sense of, even despite needing to take, safety seriously and all of these other, understanding that the pandemic is not over, having at least a couple hours where you can have the imagination of something, somewhat normal or a time, before this, I think has been cathartic for people. So, and make no mistake about it, as we signed on for this, not from a business standpoint or thinking this is going to get more people in the door, but because we truly believe that this is what should be done anyway. So that
went
combination
all in.
is,
You went in all hours, all parts of the day.
Yeah.
And what Tess is saying is, maybe you want to put your toes in. Maybe you want to do Monday, Wednesday, Friday. Maybe you want to do one of your weekends. We're seeing some of the gyms do, maybe you want to do this yoga class, but you still have this yoga class available with all masks. And that's your opportunity available. But you're providing this portion. You could get you could do this flexible schedule, but Brandon, what you're saying is you went it all in. You said, I want to do this, and I'm going to do it all the time.
That's right. And like I prefaced, our business is not a perfect analog for, many other restaurants, gyms, et cetera. But for us, wearing our ideas on our sleeves constantly, it made sense to go just kind of all over.
Well, and Cafe Aeon went all in, but except for the outdoor space. So, in Tessa, you have a couple that have done the mix of it. We have a couple breweries that are applying for their back of house, where the brew space is going for the vaccine verification program, but their front of house is going to be masked. You have some additional different models out there, correct? What are some other things you've seen?
Yeah, so I think we have a restaurant that is doing, they're going to start with just weekdays because they're not as busy. So as they sort of figure out how do we monitor people as they come in, and then weekends are busier, so they're just sticking with the masking. We have places that are just doing 1 day a week. And so far, these are all just getting implemented now. I think as weather's getting colder, sitting outside isn't going to be an option for much longer, depending on, the heating and other kinds of coverage. So I think we're anticipating, we've had more questions from restaurants and breweries coming in just about the program. And so, and we're just responding with just that, how flexible it could be. And we really encourage people to just, even without participating in the program on your own, you could just try and advertise, hey, we're going to do this 1 day or 1 night, and just see what the response is from the community. I mean, given that the majority of eligible people are vaccinated, you can assume that those people who are vaccinated want to be indoors with other vaccinated people, and we're kind of seeing that happen, as Brandon referred to what happened in New York and other places, that, it's been a boon for business in addition to keeping the community safe.
Well, and 95% of CU is vaccinated. So if your target group are CU students, faculty, know that 95% of them are vaccinated. So you're gonna have a high portion of them that have vaccine cards. So that's also a key note to make. You mentioned try it out. Now, if they tried it out and they're not part of this program, they'd still have to wear masks, but you're just saying, you could try it out and say, we'd like to have a vaccine only night.
Right. To get the feedback on how would this be just put it onto Metaverse or however you communicate with your patrons. I know I'm on a lot of different restaurant mailing lists, just to even say, let us know, would you be interested in this or not, and gauge the interest in participating.
And then your advice, if you're wondering about how do I, I'm thinking about this, I have about 92% of my workforce is vaccinated. I have some questions. I want to apply. Is your advice for people to apply and just start working through the process with Boulder County Public Health?
Yeah, I think people who are interested in it should start the process. If you have any big barriers or questions about how to do that, we have the HEVaxVerify email that I can put in the chat. I can't talk and type at the same time, but is a way for you to get in touch with us. And I think one of the articles that Corinne shared earlier was for Bonono. I'm not the restaurants in Denver. They had 9 restaurants that went fully vax mandate, and they've had not only their busiest weekend, but they only had a couple of staff who quit over it. And then I think the other side is that, everyone is having a hard time finding staff these days, but if staff can be unmasked during their work shifts, that's like a real benefit in terms of, people would prefer obviously to not be masked during their work shifts.
Yeah, that is for sure, especially back there, if they're in cooking, the hot stoves and not having to wear masks. So I know there is a question about the at-home rapid tests. We did have a question come in about whether or not the numbers would be higher because of the at-home rapid tests. And I think
we can make that assumption that yes, the numbers don't necessarily don't completely accurately reflect how many positive cases there are, because there are people who are not getting tested, people doing at-home test kits that don't get reflected in the numbers. So that could be a safe assumption.
well, a lot of times if you get an at-home test, they ask you to go get a PCR test because those at-home tests are not PCR tests. So sometimes those will then be reflected as a PCR test, which will be then captured in those numbers. So yes, the numbers are not going to be completely accurate of the total cases we have. People aren't getting tested. There's people thinking they have a sinus infection and that could possibly be COVID. So anybody with symptoms should still get tested, whether you think it's, I have a sinus infection or allergies. You should, if it's one of the symptoms, stay home, go get tested still, even if you're immunized. All right, and then somebody had a long, complicated question. I have them email me. I will take care of that via email. Any questions about the VVP program, specifically for Brandon, what he's experienced? And Brandon, I'm glad we're not on primetime television, or I'd have to like bleep you because you did use a curse word. Don't worry about it. No, don't worry about it. We're not on primetime. And then any questions for Brandon or Tessa about the VVP specifically for restaurants? Now Friday is the first date. They're saying that they're potentially gonna start administering the vaccine to 5 to 11-year-olds. Then there's 2 doses. So it is 2 doses. It's a 1/3 dose, but it's 2 doses for the 5 to 11. So we'll be still a little bit of time for those youngins. But as we start to get more and more people vaccinated, this is becoming more of a reality for more of our businesses to be able to do this. Also, with the OSHA requirements becoming a reality for our over 100 employers, more and more businesses are going to need to require vaccinations. And so this is a program that would then allow you to remove masks because you're already going to need to require vaccinations federally. So locally, you have a program that allows you to remove masks by following a federal legislation. So
Right.
what's the best way to track the 95% rate at larger restaurants, breweries with guests coming and going? Tessa and Brandon.
I'll let Brandon answer his process first.
Yeah, for us, there's a pretty, since sometimes when someone's coming in with the My Colorado app, they're using the QR code. It helps for us to have like our phone on us anyway to be able to check. So there's like an easy counting app, like one of those little tally clickers. So you can have basically one tally clicker for the number of people who are coming in. And then if it is one of those people who doesn't have that proof of vaccination, but has been basically verified by everyone in the group, we look at the number of how many people have come in versus what number is that person who is unverified in that way. And as long as that person fits within that 5% that's allowable, that's seemed to work well for us. I would not say that we are a large brewery or restaurant though, so that kind of number keeping and tracking is easy for us.
And some have just said nobody that's not vaccinated can come. It doesn't have nobody that's not vaccinated can come in. That's one, or they sit outside. I know because once you get into certain numbers, it's hard to track the entrance and out, the in and out.
Yeah, I mean, I think that it depends on the kind of dining establishment. I think for places that take reservations, when they're doing their vaccine only nights, then you have to make a reservation. And when you make a reservation, you email or talk about how you're going to provide proof of vaccination status. For people that have a lot of off the street people coming in, what we've heard is that at the host station, they kind of like what Brandon was saying, they've got like a tally, an app that tallies everybody coming in. And it sounds like that just has been working well enough, and you have the capacity you can have in your restaurant, so you know exactly how many unvaccinated people would be allowed. And you just, when you reach that mark, then you just have to tell new people coming in, I'm sorry, we're at capacity right now.
Thank you for answering that one. Any other questions for Brandon or Tessa? All right, and we will have a recording of this that we'll share with others. We appreciate those that attended. Oh, we have another person that just joined us. We are about to finish this program. We will have a recording and we will share it with the group. As a reminder, on November 17th, we will do a program at 2:00 on vaccine hesitancy. So we'll do an update on what's going on in Boulder County. A reminder, the numbers did surge by quite a bit last week, which is why there was a advisory put out. It's not a requirement, but an advisory put out by Boulder County Public Health, basically saying that when you're in large groups or when you're outdoors and you can't maintain social distancing, that masks should still be worn. The numbers jumped from the low 100s, and if you looked at Tessa's chart earlier on, the low 100s to the 200s per 100,000. So we're not even anywhere close to the 50 per 100,000 to remove masks. So we're looking at numbers that were higher than this point at last year. Our hospitals are becoming strained, and I know there's a lot of conversations about, well, what about, it's not just COVID patients, it's our hospitals are strained because of normal patients, because of, emergency situations, COVID, a lot of reasons. So they put out an advisory on Friday and our numbers are going up. We need to push vaccinations, continue to mask, and to continue to work together. We've heard this throughout all of this, and vaccine hesitancy is one of those issues that we're going to cover in 2 weeks for employees, for youth, especially as we open up 5 to 11, and then additional other youth. So if we will have a recording of this video, we learned from Brandon, we learned from some of the other restaurants that submitted some information, we learned from Tessa. If you have any other questions about anything, just feel free to continue to email and we will answer them as they come in. Until next time then. Thank you both, Tessa and Brandon. Nice to meet you, Brandon.
Thank
Yeah,
you.
you as well.
Have a wonderful,
Thanks so much.
rest of your week, everybody.